all of you to this very special and important conversation that we're going to have today, one that can potentially impact the lives and the well-being of millions of not just women, but also men in our country. And that's the first myth around cervical cancer and HPV and the diseases that HPV can inflict that we need to bust, among many other myths that we need to bust, that only women are impacted by HPV. No, boys also need the vaccine. There's a lot that we're going to learn today in this conversation. This is Cervical Cancer Awareness Month. We do have India's first indigenously manufactured vaccine, and yet there continue to be persistent ignorance, lack of awareness, myths, and even taboos when it comes to having this conversation. Now, just to put it into context, why is this conversation so important? Well, we do know that we lose 200 women every single day to cervical cancer. And we also know that these cancers, this particular cancer, is preventable. And therefore, we must step back and ask, if it's preventable, why are we not doing more to prevent it? We're going to be talking today about a very, very important public awareness campaign, I Pledge to Prevent, that has been unveiled by the Serum Institute. This conversation is in partnership with them. We'll be talking to India's leading health experts and social activists in a moment from now. But first, Janhvi Kapoor, the well-known actor, has lent her ambassadorship to this campaign, to this awareness campaign, I Pledge to Prevent. Let's take a look.
आज मुझे HPV के बारे में पता चला, ह्यूमन पैपिलोमा वायरस। HPV एक आम इन्फेक्शन है जो करीबी स्किन टू स्किन कांटेक्ट से फैलता है। HPV का इन्फेक्शन सबसे ज्यादा टीनेजर्स और 20s की उम्र वाले लोगों में पाया जाता है, चाहे उनका जेंडर कोई भी हो।
महिलाओं में सर्विकल कैंसर का सबसे बड़ा कारण HPV है। भारत में हर रोज ये कैंसर करीब 200 महिलाओं की जान लेता है और पुरुषों में HPV की वजह से जेनिटल वॉर्ड्स, ओरल और एनल कैंसर हो सकता है। HPV बिना कोई लक्षण दिखाए असर कर सकता है, जो इसे साइलेंट किलर बनाता है।
लेकिन चिंता मत करिए, HPV इन्फेक्शन को वैक्सीन से आसानी से रोका जा सकता है। इस वैक्सीन को लगाने की सबसे सही उम्र 9 से 14 साल तक है। HPV वैक्सीन के बारे में और जानकारी के लिए अपने भरोसेमंद डॉक्टर को जरूर कंसल्ट कीजिए, जैसे मैं कर रही हूँ। आइए आज वादा करें HPV को रोकेंगे।
Okay, so that's Janhvi Kapoor there trying to create public awareness. She's, of course, an actor who's just learning the facts about HPV. And as we just heard in that campaign, HPV is commonly associated with cervical cancer in women, but HPV can cause many other kinds of infections as well. And it can, as I just said, impact both men and women. So why do we have such little knowledge about HPV, and what can we do to create more awareness? I want to introduce some of our foremost experts in this space. First, it's my pleasure to introduce somebody who's well known as the teacher of teachers, Dr. Sharda Jain. She's the director at the Life Care Center in the Life Care IVF. She's the founder and SG of the Delhi Gynecologists Forum. And she has been a leading sort of voice behind many people's and women's health movements, the ASHA workers movement, among them, and really taking health awareness to the grassroots. So welcome, ma'am, to the program. Also joining us is one of India's best known practicing pediatricians, Dr. Wadhwa. He has also been a member of the IAP Advisory Committee on Vaccine and Immunization Practices. He has also authored books on COVID, and it's a great pleasure to have you with us. Also welcoming to this conversation is Dr. Satinder Kaur. Ma'am is a senior consultant and the director of gynecological oncology in the Dharmshila Narayana Super Speciality Hospital. It's a great pleasure to have you with us. And finally, and very importantly, not a doctor, but somebody who's going to lend his voice and resources to create public awareness around this is Ajay Narayan. He's been elected to the position of the Secretary General of the Cancer Foundation over 8 years ago, and has been associated, of course, in a very big way with the Rotary movement. Thank you very much, all of you. And let's have a round of applause for our experts today. And also, I'm hoping to hear stories from all of you in the audience, as well as questions and comments comments that you may have. Dr. Sharda, I'd like to start with you. This is a very important public awareness campaign, I Pledge to Prevent. But before we get to the campaign itself, let's talk about HPV. When we, took our mics into the streets and we tried to find out how much do people know, we found most people don't know anything. There is some understanding कि ये क्या है, हमें पता नहीं, क्या चीज है, इसे क्या असर होता है. Nobody seems to know clearly. So let's first talk about a very basic question. What is HPV? And who does it impact? And what are its impacts?
HPV is a virus, and it's a sexually transmitted virus, and it is seen that in adolescent and young adults, the presence of HPV is there to the tune of 80 to 85%, and in majority is asymptomatic. So once this is asymptomatic, people will not know anything about it. But once a person gets the infection, his or her own body immunity gets cleared off in 1.5 to 2 years' time. And it is seen from 85, the persistent infection is seen in about 9 to 10% of patients. And it is this persistent infection, which when it lives in the tissue, it starts proliferating and gives rise to precancerous lesions and cancer lesions. So the extent of the problem is 6 to 7% of Indians have HPV infection. And it was very surprising for me to know that educated people, in the university people who are engineers, people who are in other specialties other than medicine, and even in medicine also, people do not know the difference with HIV and HPV. So whenever we talk about HPV, then in their mind, if something is working, it is that we are talking about HIV. So there is no awareness. I fully agree with you. There is absolutely no awareness. Once we are taking the vaccination along with them and then say it is an HPV vaccination, not only it is going to take care of cancer cervix, it will take a whole lot of other cancers and other precancerous lesions because of the HPV. Then they know for the first time. That's the sad part of it, but I'm sure about it. With vaccination move, this thing will go.
So you're actually saying that there is a feeling that, or a misunderstanding,
Yes,
that HIV and HPV एक ही चीज है.
I'm telling you.
And why is it, Dr. Vadva, you deal with children and parents of children? Do you find the absence of awareness as acute as Dr. Sharda is talking about? And if so, why? As Dr. Sharda said, even among educated, otherwise aware people who will Google their symptoms 10 times a day to Dr. Google and say, "Mujhe kya ho raha hai?" Why is there such a reluctance to know more about this?
So, I think children, as is a different kind of practice, children don't do anything at all. And whatever mothers we get are usually mothers with young children. And for them, it's more important to be about the other vaccines of the children, other childhood diseases. They're still battling with their newfound motherhood.
Mm-hmm.
So we have to tell them. And over the last 10, 15 years, since the time the vaccine comes, awareness has definitely gone up. I didn't find much, that HIV, HPV, they were mixing up together, but now the awareness is definitely much, much better. They are now aware. Earlier, we used to tell them what is HPV. Now they know, they've heard about it. There is enough basic knowledge, and we have to tell them what all it protects and how to give, when to give. So now they want to know what is the right time.
And is there a resistance when you tell parents that, look, this is the age? Because see, what happens is that, we give our children many other vaccines without thinking, flu shot, pneumonia shot, malaria, mumps, measles, of course. But to this, is there a resistance? Because somewhere the confusion between HIV and HPV, somewhere the association that, sexual activity only makes this something that we can get. So why do we need?
Yeah.
Abhi kyun? My child is still young.
Yeah. So they also say that we are not that kind of a family. We don't
Yeah.
have. So with the resistance, over the last 15 years is definitely reduced. And we've seen that with all new vaccines which have been introduced in the last 5 years, starting from rotavirus, IPV, pneumococcal.
Yeah.
Initially, there's always a resistance. We are not sure about the new thing. We're not sure whether the studies have been adequate or not. But now, gradually, the resistance is gradually becoming less and less. And especially what happens is with this media and their friends haven't taken the vaccine. So it's the initial ones, which is the resistance. After that, people start following.
Dr. Satinder, if I may bring you in, the other big myth is that only girls and women are impacted by HPV. And when we took our mic around into the streets just to see what the depth of the mythology was, almost everybody said, oh, boys and men are not impacted by HPV. They see it as a female disease, a female problem. Can you talk a little bit about this myth?
So I think that the reason behind this is that the HPV causes around 6 types of cancer. So cervical, vaginal, anal, penile, and oropharyngeal cancers. But the proportion of cervical cancer is much higher than rest of the cancers. And the association between cervical cancer and HPV has been known much before this association with oropharyngeal cancers came up. That was the main, and as we know, the number of cervical cancer are very high. You have already spoken about
Yes.
that. And the mortality is quite high. So that is the main reason that the focus has always been on the females and the girl child, so that we can protect. In fact, if you see, the name of the vaccines also suggests that it is for cervical cancer.
Yeah.
So that is the reason.
Because that's the most common
That's the most common cause.
impact.
Yeah. But yes, that is very important that we have to make them aware that it is not just the females, it's the boys who can get. In fact, if you see the studies, around 70% of the oropharyngeal cancers, the head and neck cancers, they are related to HPV. And the vaccine is going to give protection against them also. Then the anal cancers, the penile cancers in males, they're all related to HPV. So it's, I think, the awareness which has to be created, and everybody has to be told that it's the both boys and girls which are affected by this cancer.
Ajiji, you have worked with, creating awareness around cancers for so many years. What are some of the cultural and societal barriers that we'll have to cross before we can actually see? It's one thing to say there is now an HPV vaccine available. There's another thing to make people understand why it's important and it has to be given at a very young age. So that makes it even more complicated, because children can't make their own choice. Adolescents can't make their own choice. Their families, their parents have to make it for them. So you're also talking about a potential generational clash in the understanding of these issues. What are some of the social barriers?
See, I think social barriers are related as much as to this is to polio. Like Rotary, I mean, I represent the Rotary side of the society. Like when we started the polio campaign, it was mainly people didn't know. I mean, were very susceptible to getting that vaccination done, and we literally had to drag children out and induce them and the parents. The same thing I have found, because we started off this campaign about in 1916-17. And when we adopted this program as a program of the Rotary, especially in our district in Delhi, we had a problem. I mean, parents were not school children, the principals and the authorities were not interested, and because they did not know. They might have heard about. So the barrier was that getting them to understand. So we thought the best way was to go into the schools. And there also the problem was the private schools were receptive to getting this vaccination done. The parents were educated. The government schools and the corporation schools had a problem that they needed a permission from the higher authorities to get the program going on in their schools. Wherever we could tell them that yes, we need for them to understand. The parents, the teachers and the principals did play a good role, because they were aware that yes, there is something known as cervical cancer. Getting through to the parents, making them aware, that was a first barrier that we had to cross. And I would say we have successfully done it in many schools where we have done this program.
In polio, in other diseases, but here the problem, I would imagine, Dr. Sharda, is that because it is associated with sexual activity, there will be a cultural taboo around it. Do you find that?
See, we have learned jointly among gynecologists and pediatricians that we are not going to sell this vaccine as cervical cancer prevention vaccine.
Okay.
We're going to sell it as a cancer vaccine.
Right.
So it makes a logic to them. Okay, there is a cancer, there is a things available. Also, kaun se cancer hai? So when you start telling them it is a cervical, vaginal, anal, and throat cancer. So they have heard something about throat cancer. And as we know that nearly 20% of the throat cancers are also related to HPV, it makes sense to them. And then I don't find, we don't talk about sexual activity at all in this. But the premise we definitely want to give it to people that it has to be taken between 9 to 14 years. Before a person becomes sexually active, if they take this particular vaccine, they will not get HPV infection.
So it's protecting them for a future when they're adult enough to have these conversations, but their families must take these decisions for them. If I may just bring you back into the conversation, Mr. Jain, because you were talking about being in partnership with schools. How important do you think it is? And I think Dr. Sharda makes a good point that let's make this a conversation about a potential future cancer that is preventable if you act now.
See, partnership or understanding or doing this program in schools, we thought was the easiest way to do it, because instead of going out into areas where the lower strata of society or the daily workers are staying, and the families are staying, they might be here today, they might not be there after 6 months. And at that point of time, when we started, the bottom line was that it has to be 2 shots of even Gardasil, which we're using, and Cervavac, yes, when it came up, 2 shots. So getting the child back after 6 months was a problem. So that's why we said concentrate on the schools. We have in Rotary about, we are associated with at least 300 schools in Delhi and the NCR. So our target was, and it took me, or took us 2 years, because we started in 16, 17, and then I think we actually started in 1920. The actual vaccination, we could we had to get them to understand that yes, this is necessary, and that is it. But we did face a lot of problems even getting through to the parents.
Dr. Sithinder, what is the best way to get through to parents?
So that's what I was going to give the suggestion. We should focus on schools, but I think we should focus on the parents rather than the children. If we are giving information to they are not the decision maker. Children are not the decision maker. The decision maker are the parents. The awareness has to be given to the parents. So if we are focusing on schools, we should do it during the PTMs. Maybe before PTMs, the school can organize events for the parents, and they are educated. They are going to take the decision finally, not the children. So in my personal experience also, I have talked to a few teachers. This has happened because we take awareness talks for the teachers as well as the parents. But we have seen that few people had actually taken it for the students. And there was a lot of misconceptions, because then students are going to go home and Google about what is cervical cancer. And we have seen that sometimes I had a personal experience that one child, she started menstruating and she linked it to cervical cancer. She went into depression thinking I have had cervical cancer because she just started her periods. So the awareness has to be done in an appropriate way, and the target audience have to be defined. The decision makers have to be looped in rather than looping in the children at this point of time.
That's a very important point. And as a pediatrician, I'm sure you would agree that the target has to be parents, not children. While I take Mr. Jain's point that you need schools to, if this is to become a mass amplified message, at some point you will need the participation of schools. But we are very much at the cusp of this campaign right now. Where would you start?
At least the awareness throughout, even for the doctors, for the parents. Lots of times parents also, they don't know much. They go to their physicians and ask them, and physicians also don't know much. Another common taboo is that they think that it should be given before the period starts, or sometimes they think after the period starts, and whereas it has nothing to do with that. Even now, people say that why give it now? She hasn't started with her chumps. We tell them it's 9 to 13, 9 to 14 is the recommended age. And the best thing which works is if you tell them that now it will be 2 doses, later on it will be 3 doses, which works the best, because saving cost is very important.
Yeah.
But as far as the campaign is concerned, I think it's the awareness all around. Not only parents, the doctors, the students, everybody need to know. The discussion has to go around. Finally, if the cost is much, then the father has to be involved in it, because he's going to pay. The mother will say yes, but father has to take out the money finally. So the children start the decision, start the discussion, the parents decide, and they can talk to their doctors, and doctors have to be aware about it. I mean, they should encourage doing it rather than postponing or saying that it's a new vaccine, wait for a while. In our clinics, we've got posters, big posters in the clinic. And so when the parent comes inside my room, they've already read the poster, they are aware about it, they ask. We can't preempt if the child is sick, we can't talk to them about the vaccine because they're wanting to know more about the sickness just now. So once they've read, they ask themselves. That is important.
Yeah. So let's actually talk about the vaccine itself. There's been so much talk about the kind of confusion that a teenage girl may feel when she gets her first period. There has also been this constant linkage, even in the COVID vaccine, we saw constant speculation. Or if we take this vaccine, will it impact our fertility? Will it impact our menstrual cycle? And people sometimes get scared of vaccines, especially in women. Will it impact us in any other way? So let's talk straight about the vaccine itself. The efficacy of the vaccine, the effectiveness of the vaccine, and any side effects that people may worry about. I'll start with you, Dr. Shah.
HPV vaccine which are there in the market, the one thing is very safe. There are 9 bodies which are taking care about their safety, and they found that millions of doses have been given across, and they found that as for the safety part is concerned, there is no doubt about it. Secondly is that it's very efficacious, 98 to 100%. It is the efficacy as far as HPV related diseases and cancers are concerned. So this particular vaccine is very effective. Thirdly, about the side effects. The side effects in my long practice as a scientist, vaccinations have come, I find there is no side effect which has created a scene in my clinic. No. Patient,
so no significant side effect at all.
The patient's mother definitely tells you, madam, whenever she takes a prick for a blood sample, she creates a ruckus or she faints or something of this particular kind. So we especially see to it that doctor only gives the injections.
Okay.
So this is what we find, and as far as the HPV vaccination is concerned, it will not be given by nurses. We give the doctors take it, and we tell them there is no.
And you do that because to address early apprehensions.
Yes, because the senior the person is giving, they think
they're comfortable with it. Anyone else wants to come on the vaccine? I'll come to the costs later. But Dr. Sharda says it's completely safe and it's very efficient.
Yeah, so same 98 to 100% efficacy, and side effects are hardly any, like any other vaccine, like pain, swelling, redness, which goes off in a day or two, or maybe this taking paracetamol, cold formulation. And very few of them do have syncopal attacks, but then you give them sitting, you give them lying down. Like all these children who are very apprehensive, you can't preempt that this child may fall down.
Yeah.
So, they say the child is very afraid of needles, injections, blood.
I mean, I'm afraid of needles.
So we'll give it to you lying down.
I'm too old to get it now, but that's the other thing that Dr. Sitharaman, there is an age, and you all have mentioned it, 9 to 14. Is it the same target group for boys and girls, or does it vary the age group?
So the target group is same for boys and girls. It's 9 to 14 years. It can be given up to 26. 14 to 26 is the catch-up age. 15 to 26, which if people have missed it from 9 to 14 years of age, then we can give it from 15 to 26 years of age.
And Mr. Jain, since you're not the medical doctor, if you had to amplify this message, vaccine is effective, the vaccine is safe, where would you start in getting the word out? How would you convey this to people? What is the best way to get the word out?
In India, it's very, very difficult. I mean, let's face it.
Yeah.
But I think the best target area is the schools. Because
you still feel that even though the doctors say you have to convince the parents?
Pardon me?
I said all the doctors believe that you have to convince the parents, but you believe that you have to start at the schools.
The schools, because they're convincing the parents is easy. Because the management is there. And if the school is organized and programmed, then you find that the parents do come and understand what it is. And over a period of time, the interaction between the principal, between the management or the teachers and the parents is such that they tend to agree with what the management is saying or what the teachers are saying. So schools, whether it is the private schools or it is the government schools, we should get down to that level. And the biggest partner in this would be in polio, I would say government came out openly and adopted it. Unless the government, the central government and the state government do not reach out to their schools and tell them that, yes, this is necessary. It is, again, as good as any other program. we are not going to be very
So we need
successful.
the government endorsement. It can't just be done in the private sector alone.
Yes.
Now, this is a very important point. There has been some talk that the HPV vaccine would be included as part of the national immunization program. Mr. Vadva, you have served on some of these vaccination committees. Where do we stand? I think Mr. Jain has raised a very important point that you see to create acceptability in the minds of the general public, you need to believe that this is a public-private agreement.
So once it is accepted in the national program, our job will be solved very easily to multiple fold times because the awareness comes, everybody is getting the vaccine. So, they know that government is giving, that means we all have to take.
Yeah, that is still the attitude with which people
So
think.
we expect it to happen soon. They were planning to do it now, but there are some technical issues that will probably start next year. So once it is started, then it will be easier for us.
So, Dr. Shraddha, if you can add to that, because I know there are FOXI guidelines and you were just sharing them before we started this conversation. Talk a little bit about where we stand in terms of affordability, doses, and how soon you think that this can be part of the government program, what that might do to costs. I think there's a lot, very little information in the general public about that.
See, once this indigenous vaccine Cervivac came, and you can see that people who have a political power came forward as far as the inauguration part was concerned. We were very hopeful that in 24 itself, it will be part of the national immunization program. We thought probably before the election they will announce it, but we just came to know that there is a hitch there. But what I feel is, if we have to take to 90% of the adolescent girls short of government funding, we can't reach that 90% target. Private sector can contribute 15%, it can contribute 20%, not more than that. So the government has to chip in. And earlier they chip in, the better for it. Because out of the strategy which WHO has given a roadmap for cervical cancer elimination is, vaccination has the biggest role. If we give our adolescent girls this vaccination, 90% of a job is taken care of. It is very effective, it is doable, and now the indigenous vaccine is available. I see no block here.
Even otherwise, our other vaccines also only 10% are given in the private sector.
Yes,
90% are still in the government sector. And like you are asking me, when we tell them parents that NHS is giving, and they know NHS is a government-funded body and NHS is giving vaccine, so they feel that it's important. When NHS can give, we should also give it to our children.
So, given the hitch, what are the timelines, Dr. Sithinder, you think we're looking at for this to be a government sort of backed program? And if it doesn't become that, then in the meantime, what is the approach of doctors like yours? Like till such time as it becomes that, let's put it like that.
See, WHO has set a target for us that we have to vaccinate 90% of the girls from 9 to 14 years of age group by 2030. If we are able to do that by 2030, we might be able to eliminate cervical cancer in the next century. So that
really,
is
let's just repeat that. That's a very important point to process.
So if we are able to vaccinate 90% of the girls between the age group of 9 to 14 years by 2030, we will be able to eliminate cervical cancer by next century. And elimination means bringing down the incidence to less than 4 per 1 lakh women, which is currently 18 per 1 lakh women in India. So this is the target which we are focusing on. And because of this target, India is a part of this WHO call, and we are focusing so much on vaccination of these girls, and we are promoting it at individual levels. All the bodies, the private, the gynecologist bodies, the pediatricians, everybody is promoting this vaccine at their individual levels. But yes, the government has to take part, and government can do it. We have done it for COVID-19. If they want, they can do it. If we all know from the experience of COVID-19 vaccination, within, I think, 9 months, 1 million doses were given.
Yeah.
1 billion doses were given within 9 months. And if we, the target age group, we are considering 9 to 14 with the current population of 1.4 billion, there are 60 million girls which need to be vaccinated. which is not a very big target for our government. They
And
can
I
choose.
think I'm struck by the fact that you actually say that this is a cancer that can be eliminated
Yes.
if there is actually enough mass mobilization of the vaccine program. And perhaps is this the only, I'm asking an ignorant question as a layperson, is this the only purely preventable cancer?
Yes.
I mean, I can't think of any other cancer that
This
is.
the only cancer which is 100% preventable.
Prevent.
So this is the only cancer that is 100% preventable. I think that is something we really all need to internalize the importance of. And with vaccination, you can actually look at a possible scenario where it can be eliminated. And that's something staggeringly important. And Mr. Jain, I come back to your point. School partnership will also be easier if the government is on board.
Absolutely.
Now, till such time, where do we start? Before I open this up for comments and questions, go ahead.
Yeah. See, 2 days ago, I have got calls from the Rotary counterparts in Tamil Nadu.
Mm.
Now, they wanted to understand how we have come out with the cancer program and cervical cancer vaccination program here. So I've explained to them, we are in touch. They want to take it up in their districts. So, I mean, I feel till the time that the government doesn't come in, people like the NGOs like the Rotary and other organizations should step in and should take this forward. But then again, we are also limited with funds.
Yeah.
There are limitation of funds as far as we are concerned. So unless the pricing is brought down and the cost of the vaccine comes down, or there is some sort of a support from the government, it's not going to be possible even for the NGOs to take it up. We recently did a camp of about 1,000 girls being vaccinated in Ghaziabad. And that was purely the weaker sections of the society, and those that funding came from a CSR funding. So we have to reach out, or the government has to reach out, or people like us have to reach out to CSRs, to companies.
So basically, the government is needed for two reasons, Dr. Satinder. One is to, in a way, put the stamp of legitimacy so that any minor niggling doubts that people have will be put to rest. And two, it's a cost issue also, because to make it accessible and affordable to all, you need the government to also put not just its endorsement, but also put money on the table.
Money on the table.
I want to ask, before I open this up, one most important thing that you think has to be at the heart of this I Pledge to Prevent campaign. Who should it be targeted at? How do we spread the word? One suggestion that you would all make. So I'll start with you, Dr. Shad.
I think the focus has to be on adolescent, first on girls, and at the same time, I'm a very strong proponent that it should be given to boys as well. So both boys and girls between 9 to 15 years should definitely be vaccinated by the time they do class 5.
By the time they do class 5. Dr. Barkha?
Same, actually, like you said, one point would be awareness. I think awareness that it has to be given, it's preventable 100%, if not 100%, I think 98, 99% preventable. And if something can be prevented, something like cancer can be prevented, why not? So awareness is probably the most important thing in all age groups, starting from children 9 years to parents.
And I mean, as I keep thinking about what we've learned in this conversation, that this is the only cancer in the world that is almost 100% preventable and can actually be eliminated. It just requires people to understand that the vaccine has to be given at a young age, between 9 and 14, to boys and girls. Dr. Satinder, what will strengthen this campaign? We've heard schools, we've heard government, we've heard funds. What else?
I think the power of social media lies here. The awareness has to be created in all the social media platforms, because definitely cost is of matter, but there is a section of society, at least 10 to 15%, who can very well afford it, but still have not availed the opportunities. We can promote something like a buddy thing, like if those who can afford, they can at least fund for some other child also of a lower socioeconomic status, which can help if the government, till the time the government comes in. We can promote the CSR funding. We have a lot of NGOs. We just need more of promotions. We need a lot of social media things to come up, and maybe some public figures, celebrities to come up and actually popularize this vaccine, who the general public is going to listen to.
Yeah. So I think to that extent, actors and, a celebrity like Janhvi Kapoor coming up and saying I pledge to prevent is important. And I think, wherever we know people and we can use our influence to get the word out. Mr. Jain, you have given us the idea of schools. One other idea from you.
It's Ajay, not Jane.
Oh, I'm so sorry, Ajay. Ajay, one idea from you.
No, what she was saying, I think who better or who else could be better than you to understand that this impact of social media, the focus of the government, and making them aware. It is, if we can do it, polio was done in a huge manner. Look at the people who came out on the streets to do those ads for the TVs, which people were seeing. The Juggi Jhopdi colony people were seeing the television.
Yeah.
And were seeing Amitabh Bachchan or XYZ and big people. I mean, the people who are controlling these programs for you, like for you, with you, when you came out openly, the media came out openly, it impacted. And I think we need to do the same thing. It is a
And I think
creation.
for boys,
you
we
have to
should have
create
males
that
also
set.
coming rather than only.
No, and what Ajay said is very important, because I also remember that the destigmatization of HIV, or creating awareness that, shaking someone's hands. I still remember Shabana Azmi coming and hugging a person with HIV to say that this is not how HIV is transmitted. So as Ajay says, you really need that star power and mass media. Sorry, Dr. Madhva, you were
I
saying.
was saying males also should be involved, because if we want to promote boys vaccination, we should also have male people,
Male celebrities and male ambassadors with
male
following
ambassadors.
endorsing
I
this.
think very important information which media can pass on to the public is that as far as the WHO is concerned, in 2020, they come out with a report that if you give 1,000 vaccination, 20 lives can be saved. No other vaccination is close to it. So I think this particular part is that, if you're giving 1,000 vaccination, 20 lives you're saving, it is going to make a lot of difference.
Okay, let's just open this up. If anyone has any comments, we can pass the mic around. Does anyone has anything to share? Has anyone here got the vaccine or knows somebody who does, or wants to talk about their experience? What are young people saying? What are doctors experiencing? I'll start with you. Yes. Yes. Yes.
Okay, madam, I am Dr. Shyam Singh.
Hi,
I'm
Dr.
a
Singh.
senior gynecologist at
Nice
RML
to meet you, sir.
RML
Yes.
Hospital.
Yes.
Actually, madam, I think in the OPD, some awareness is there, but we need more awareness, like in the family planning program, then pulse polio program, all these things, including all the social media, then schools, SRC, we all this including, and all the publicity should be done in the OPD, especially in gynae OPD.
Can I ask you to just come here so our camera can also get you?
Yeah, in the gynae OPD.
Can
madam,
you just come here?
because we are doing it the cancer monitoring program with
Yes.
the web smear, then other HPV vaccine, HPV monitoring, all these things we are doing. But what we found out is that even with when I was in the CGHS, many patients come forward for this, whether you can write this vaccination. But when that come to the cost, they again regret, because the CGHS is not paying for them. So they ask about this, how we'll get it. But I said the benefit of it is that earlier that you get the vaccination, you will have more protection and you will get the more benefit of the vaccine. So
what is the biggest stumbling block?
what is
according to you?
stumbling is that, madam, it is the understanding and the financial sector, which has to be provided by the government, and the motivation. Because without government, we cannot go to the nook and the corner of the country.
So we keep coming back to the involvement of the government. If someone wants to respond to what doctor has said, anyone? Satinder?
Yeah, I think government role is important, but as you said, the most important thing is awareness. So because until and unless we make people aware of it, they are not going to push the government also.
Yeah.
I think
So everybody needs to push the government for the same thing.
It's a multi-pronged approach. It should be a multi-pronged approach.
Yeah.
in the school premises, we must have a big board. Have you taken HPV vaccination? It is must for both boys and girls. So I think a child morning and evening, the teacher's morning, evening sees that particular board, which is there 365 days. And I think it should become a part of the curriculum, My Health. So where a vaccination is written that these vaccinations are important for me and I have to take it.
So it goes back to Ajay's point about schools and schools being where you need to start. Anybody else? Anybody else? Yes. Yeah, go ahead.
I'm Dr. Sangeeta Gupta. I'm a
Can I ask you
consultant
to just-
gynecologist.
Yes.
And I am dealing with the medico-legal aspects of different aspects of obstetrics, gynae, as well as vaccination point. Now, my question is when you are making aware to the parents, and I think equal awareness should be children, because their vaccine has to be taken by the child. and a 12 years old child, who is more than 12 years of age can consent or dissent or assent for his or her own vaccination. So how
I mean, I don't know if any parent would agree to that at 12 years. You're saying at 12 they should be allowed to consent or...
Yeah, that is the official legal
I
term.
understand, but in real terms, I don't know if that's how it happens. Yes.
I want to know that why only the important, of course, financial aspect is one thing, that who is going to pay for that vaccination.
Yes.
But it is the fear of the child, or it is the inborn apprehension which he or she is not telling the family that she is involved in the sexual activity, you know. So that is the question, that why not we should give more focus or equal focus to the awareness of adolescent. Secondly, since it is not as per uniform consent, still, do we have any information statement, vaccination form, signature when we give this HPV vaccination? My two.
Okay, these are interesting points because yes, Dr. Shadda.
As far as the vaccination is concerned, there is nowhere signatures are taken. When they request, they make a payment like in a private sector, a consent is indirectly there. It's implied consent. So we don't have to take a vaccination, the consent for the vaccination.
But madam, in India also, there are legal suits and medical legal compensations are being asked for vaccination complications. May not be in HPV, but in general, there have been legal suits and compensations for vaccines. So why don't we take just a information statement about the vaccine? We give, as Dr. Barkha said, कि हम patient के parents को आने से पहले we give them a statement.
No, there's
schedule.
a IAP has given information statement sheets,
Yeah,
and you
that's
can
what
keep
I'm
in the
asking
clinic.
for.
You can show it to the parents.
Yeah.
But like you said, consent cannot be given
No,
by
I'm
a
not talking
12-year-old.
of now
The
consent.
parents give
Okay,
a
let
consent.
him respond.
What I wanted to say was, a 12-year-old, if the child doesn't want to take the vaccine, you cannot force. You can't, like a small child, 3 months, 6 months, 1 year, you can't force. And HPV is not a vaccine you can force upon a child.
Yeah.
So suppose it was a rabies vaccine, I would have caught him and give it to him.
Yeah.
But for HPV, we have other options. What I do is we have a needle-free injector also. So they are afraid of needles. It's not the vaccine. They are afraid of the needles.
Correct.
So you fill up in a needle-free injector. It's a cartridge. It goes without the needle. So we've done that, and all these children do take it easily.
Oh, that's interesting.
Yeah, that is rather interesting. I wish we'd had this when we were young. But ma'am, let me just open this up for anybody else who might want to respond. Consent, a 12-year-old's consent. I don't think Indian
Very
families think like that.
Very difficult. According to me, a 12-year girl or a boy giving consent is not acceptable. We have to involve the parents.
Now, it is the vaccine information statement, as Dr. said. So why don't we involve child more than 12 years of age in reading that? Why we focus only on parents? I mean to say, the child has to be fully involved in
The
that.
Indian society and the Indian parents.
No, but there is going to be, there is a
Appropriate
change.
dissemination of
Can I
information
just
is
take the
required.
mic, ma'am? Yeah.
The child should be informed, the parents should be informed, the appropriate dissemination of information should be there. But finally, the point comes back to that the decision maker is finally the parents because they have to pay. So that's it. So information should be given to both parents and children, but it has to be given in appropriate manner so that it doesn't create any fear that this is a sexually transmitted disease and that's why I'm getting this vaccine. If I was not sexually active, I should not take that vaccine. So it has to be given in an appropriate way to the children as well as to the
Next question. Yes.
Yeah, I am Dr. Pallavi. I'm preventive oncologist at AIMS. And I have two queries. One is, rather one comment and one query. So one is, we are talking about awareness, very good. Yes, we definitely need to raise awareness, but we also need to raise awareness about where is the availability of this vaccine. So whenever we set out any campaign on awareness of vaccination, a lot of query comes to us as to, madam, we are ready, but where is the vaccine? Please inform us. We can get it in private also, but please. So that information is not available. And as you were saying, that till the time government puts that in place, we should be knowing where this vaccine is available, even if it is at cost. Because there will be desirable people who would want this.
I think this is a good question. Like,
No.
if we were to ask Dr. Vadwa people randomly, okay, suppose some parent says, yes, I would like my daughter or son to get this vaccine, but I don't know where to go and I don't know how much it costs me. I don't know how many vaccines I need. Is it 1 dose, 2 dose? What is the gap? Like even these basic questions, a lot of people don't know. So if you want to just take that question.
So you can tell them that go to any pediatrician or a gynecologist. They are the ones who will give you the vaccines.
Correct.
anyone.
So because
At
I'm
least
in
in
a
city of Delhi, it is available with every pediatrician and gynecologist.
agrees, because I'm in a public setting, so I'm not aware how the private
No,
people
no,
are
all
doing that.
pediatricians and most of the gynecologists will have it.
Thank you so much.
But I have a related question. You see, till the government gets involved, in some ways, this will be seen as something only the wealthy or the rich can do something about. How do we talk about, if we can break down the data, how does cervical cancer impact, or other cancers caused by HPV impact the poorer sections of our society? If one of you can speak to that, Dr. Sharda, because you've been involved with grassroots movements. This is not an elite disease and an elite cure. And I think that's what's very important to know.
See, question as far as the cancer cervix prevention is concerned, vaccine has a great role. It is said that it is belongs to a poor class of patients, but we find, that barrier is breaking now. Previously, we used to think only the elderly people get it, but now we find a girl of who's gets Miss Universe contact, and she dies at the age of 26 because of cervical cancer.
Yeah.
She had been suffering for 2 years. So there are many celebrities who are at a very young age they're getting it. So I think we should not make an issue that it is only the problem of the poor people and not of the elite group. I think we should not put.
No, exactly what I'm saying. I'm saying till this is part of the national immunization plan, there will be a perception. Like in public health, I don't know, like, do you get queries about it?
Yes, we do. Whenever we conduct some campaigns, we do get.
Yeah.
We have vaccine for our EHS beneficiaries, but what about the non-EHS
So
people?
actually, that is the problem with this. This
Yeah.
cervical cancer is a disease of low socioeconomic status. But we are vaccinating the high socioeconomic status because those are the ones
Who can afford it?
who can afford it. So that is why the government role is so important, because the right target is the people of low socioeconomic status, which are at higher risk of cervical cancer as per the statistics.
I completely agree.
Yeah, Ajay, you were wanting to add? Yeah.
one-
Sorry, you have one more.
One more query.
Huh.
So it's about Cervavac. So I am pretty much confident about this vaccine, no hesitation on that. But still, because we are in the post-marketing phase of this vaccine, so what is the platform or the mechanism available to report the adverse events?
Okay,
For the
two
beneficiary and
very
the
separate
provider.
questions. I'll let
Yeah.
Ajay complete his point on the the rich poor divide, and then Dr. Sharda can address if there are safety concerns. Yeah.
See, like she's coming from AIMS and Institute Rotary Cancer Hospital,
Yes.
where we are associated with. Although we have been there for so many years, but it is now, I think, just about 2 months ago that we started thinking that how to reach out to the public. So we are coming to some sort of an understanding that yes, the Cancer Foundation and Rotarians will emphasize on AIMS, and we will every month have a camp at there, and they can tell the people who are coming, because I get phone calls every day, sir, हमने vaccine लगवानी है, हम कहाँ लगाएं? So my answer to them is कि जब अब कैंप लगेगा तब हम आपको बताएंगे. We don't have actually a very fixed place, but if we have fixed places like the AIMS or other hospitals where institutes and NGOs can come in and provide it free, then I think it will become very effective. Otherwise, we tell them, go to a gynecologist, like you said, doctor, that go to a pediatrician and they will be able to give it. But then there, the question of money comes in.
Yeah.
And then they say, नहीं sir, आप तो मुफ्त में देते हैं, हम वहाँ जाएंगे तो हमारे को पैसे खर्चने पड़ेंगे. हम कितना भी खर्चे, then we have to tell them what is the price. So they said, हमें रोटी नहीं मिलती है तो हम
कैसे देंगे?
इतने ये वैक्सीन कैसे लगाएं? So that is it. I think government's role again
is critical.
Is very, very critical.
Okay, we have time for one last question from the floor, if anyone has. Otherwise, we'll take last. Yeah.
She had one more question also.
No, she asked. Oh, sorry, we didn't answer that. She said if someone has a side effect, what is the mechanism? Dr. Sharda or Dr. Wadhwa, if you want to take that.
I was telling her that there is an adverse event reporting system. All companies have it. I've also reported one case in the MSD website. The Serum Institute also has it. Otherwise, you can go to IDServe, which IAP has it, and from IDServe they send it to the related company.
No, I think this is a point we had really not bothered about it. It is definitely there on the pamphlet, and the company gives a site that you can report it to them. But I think we can put up something in the OPD also in case if anybody has an adverse reaction. Please let us know about it.
Okay, last comment. Go ahead.
Hi, my name is Ruchita Mangal. I'm a college going student. So basically, if you don't take up the vaccine, so what are the other ways in which you can prevent this particular cancer?
Okay, before they answer that,
No,
would you take the vaccine? Let's first talk about what made you take it. Who took that decision for
So
you?
my father decided to take the vaccine.
So your father decided.
Yeah.
And how old were you when you
I'm
went?
23.
You're 23. And when he suggested this to you, what did you feel? Like, did he know more about HPV than you did?
He knows more about me.
Is your father a doctor?
No.
No. So कैसे हुआ? थोड़ा बताइए.
So my father works in Serum Institute.
I see. So he
Yeah.
had some knowledge of it.
Yeah. Yeah.
Okay.
So I
But
think she's brought up a very important point. And
but she's brought up a point. Yes, please take
I
that.
will just suggest you, I think Madam Barkha, you can explore on it.
I'm not a doctor.
Delhi University
Anji.
took decision some time back,
Yes.
about 7-8 years back, once the vaccination has started, that you will not be promoted from first year to second year, even if you clear examination, unless you've taken a vaccination.
Really?
For 2 years it was effective, and suddenly it just disappeared. So how it has happened, I do not know.
How interesting. But she asked a question that a lot of people may ask Dr. Satinder. अगर मैं vaccine ना लूं, तो कोई और तरीका नहीं है?
So yes, this is a very important question. See, we all know HPV is sexually transmitted.
Yeah.
Though skin to skin contact is also an important thing, but the most, as with all sexually transmitted diseases, you have to maintain personal hygiene. You have to use barrier methods of like condoms and all for so that you can get protected against sexually transmitted disease. But the most important thing is screening.
And even if you take the vaccine, screenings are important.
Screening is
We must
important
emphasize
because
that.
the
yes.
vaccine, as we said, has 97 to 98% efficacy against the viruses which are included in the vaccine.
That's right.
But apart from that, there are so many viruses which are not included in the vaccine. So HPV 16 and 18, which are the main components of all the vaccines, they cover around 70% of cervical cancer. There are still 30% left against which you need protection. That is why screening is very important. And screening has to, and all females more than 21 years of age up to the age of 65, they need to get themselves screened using a pap smear or an HPV test. Pap smear needs to be done once in 3 years, and if you're using an HPV test, it has to be done once in 5 years. And it is also important that once the screening is done, and if we are able to diagnose some precancerous lesion, it has to be treated at that very moment.
Yeah.
I just wish to tell you that from the last 65 years, developed world has been doing the screening program. They have not been able to eliminate it. They had been able to decrease the HPV infection in 70% of patients, but not eliminate it. Once they have added injections, then only they will be able to eliminate it.
And there's scientific reason to it also.
Which is?
Actually, the cervical cancer could be adenocarcinoma or the squamous cell carcinoma. So the pap smear picks up the squamous cell carcinoma, cannot pick up the adenocarcinoma. So that will be prevented only by vaccine, not by screening, because the screening doesn't pick it up.
Last word to you, Ajay. Last thoughts?
I think I would appeal to basically the companies who are into the pharmaceutical manufacturing, Serum Institute, and if any other company is coming up, that they have to have some sort of, I don't know whether it is there, but they have to have some sort of an understanding with the government. And like we did the COVID vaccine.
That's right.
I am a firm believer that if, until and unless the government steps in, the media, the social media projects it to everybody, every television that is there in a jhuggi, we will not be able to do much. And if we could do it, if polio we could eliminate.
Why not with HPV?
In 20 years or 25 years. If we could, you're saying turn of the century, Dr. You said turn of the century. I think we could do it by 2030. 2030, if there is a big impact like this, and 2030 or 35, we would be able to say that yes, India is cervical cancer.
That's absolutely. Well, in new cases could be eliminated. Is I think the more accurate.
It develops 20-25 years later. So even if you vaccinate them now, all those who've already got the virus inside in 2000, 2005, 2010, they will still develop. So we'll not be cancer-free, but we'll be proud to say that we're all vaccinated.
But now the WHO report has instead of we were thinking century, but we can bring it down in just 50 years.
Yes, we can reduce it to a minimum. Rather than being the second most common cancer, if it's the 10th or 15th.
And one thing we didn't talk about is currently what percentage of cervical cancer fatalities are from India? Do we know?
Yes. India contributes to 1/4 cases, global cases of cervical cancer. And as far as the total fatality is concerned, 1/5 of the total global deaths occur in India. And that is 77,000 was in 2020, which is not a small number.
Which is not a small number at all.
Secondly is, again, media requires an emphasis. The total pregnancy deaths in this country are 25,000 and total cervical deaths are 3 times more. So it is the focus has to be there of the government. On one side, you are preventing maternal mortality.
Yeah.
And on the other side, you are sacrificing because of the cancer cervix. That's not done.
So I think those are the numbers that we need to really internalize, whether it takes 50 years, the turn of the century. The fact is that for this generation of young boys and girls, for your children and your grandchildren, even if our generation is too old to have benefited from this vaccine is now available. If there is more awareness, there is more messaging, there is more amplification, more questions from parents and schools, I'm sure the government by itself will also feel the need to partner these programs. So I think we have to start with awareness that then brings in the government, and then that brings in greater awareness. These are preventable cancers. These are preventable deaths, and more women being impacted today by these deaths than even maternal mortality, where a lot of deserved attention is, but perhaps we need much more of the health system's attention here as well. Thank you. A big round of applause for our experts, to Ajay, Satinder, Arun and Dr. Sharda. Thank you so much, and thank you for sharing your opinions from the floor.